A high-level UN delegation headed by Mr. Dereje Wordofa, UN Assistant Secretary General and UNFPA Deputy Executive Director, arrived in Asmara on Thursday, 18 October for a two-day working visit. The delegation also included the UNFPA Regional Director for East and Southern Africa Region, Dr. Julita Onabanjo, and Mr. Ramiz Albarov, UNFPA Policy and Strategic Division Head at the UN headquarters. The strengthening of partnership to sustain development gains in Eritrea was the focus of the mission. In a meeting with the UN Resident Coordinator and the heads of 5 UN agencies, Mr. Wordofa was briefed on how the agencies are working together in the framework of the SPCF in coordinating UN support to the development efforts of the government of Eritrea. The One UN initiative remains strong in Eritrea, and earnest efforts have been made to integrate emergency and development programs. Mr. Dereje said that the UN country team has exerted much effort in Eritrea to work coherently, and that the SPCF is the single most important planning and coordination tool.
We need to continue building on the progress Eritrea has made. It has registered impressive performance in the health and education sector, but there are miles to go. And United Nations, UNFPA included, are standing together to support and work in coordination in a partnership with the government of Eritrea and the people of Eritrea.
The One UN initiative is all the more relevant today in view of the UN reform underway in the effort to realize the goals of the 2030 Agenda on Sustainable Development in the remaining 12 years, he added. Following the lunch meeting, the UN high-level delegation headed to the UN compound for a brief tour of the country office. The UNFPA staff accorded the delegation a warm welcome.
The work of UNFPA complements the work of United Nations as a whole. There are different agencies with different mandates serving the people of Eritrea, and they have a very coordinated effort. UNFPA is mandated to work around the reduction of maternal mortality, working to improve family planning through information and services, working to reduce harmful practices, especially ending female genital mutilation, ending child marriages, the work around maternal care.
The high-level UN delegation held discussions with the Ministers of National Development, Health and Foreign Affairs on ways to strengthen UNFPA's partnership with the Eritrean government in the framework of the UN Strategic Partnership and Cooperation Framework, SPCF, and addressing bottlenecks. In a meeting he held with the Minister of National Development, Dr. Mikhail, Mr. Dereje thanked the minister and congratulated the government of the state of Eritrea for the efforts undertaken under the leadership of His Excellency President Isaias Afwerki, and appreciated the cooperation that is existing with the UN through the Strategic Partnership Cooperation Framework 2017 to 2021 through focused investment. Following a briefing on the current peace developments with neighboring Ethiopia in particular and the region in general, the Minister of National Development, Dr. Mikhail, stated that Eritrea, despite of the previous impasse of no war, no peace situation, and against all odds, was able to register big achievements in the area of health, education, agriculture, and other sectors. He added that the nation-building process is very long and demands commitment and proper planning, especially in this era of the Sustainable Development Goals, which the government is tirelessly working towards the achievement of the agreed targets. On the 15-year time frame given for attaining the targets set for the Sustainable Development Goals, SDGs, the minister said that Eritrea would not have to wait long to attain these goals.
When I talked with the Honorable Minister of National Development, Dr. Georgis, he told me Eritrea shouldn't be waiting until 2030 to achieve the Sustainable Development Goals. We agree with him 100%. This is very important. This is a country which is resilient, endured very tough situations, and yet registered impressive progress. Therefore, if we add new resources, new effort into what has been done, of course we can achieve the Sustainable Development Goals well before it is time.
In a meeting held in the afternoon hours of the same day with Ms. Amina Nur Hussein, the Minister of Health, Mr. Dereje appreciated the progress so far made in the health sector. He reaffirmed the commitment of UNFPA towards supporting the government and people of Eritrea in addressing areas of priorities and towards the achievement of the SDGs. He praised the leadership and ownership of government in all spheres and highlighted that timely implementation will lead to more resources and support.
So overall, UNFPA is working very closely with Ministry of Health, working with Ministry of National Development Plan, and a number of other sectors to help government improve universal health coverage and primary health care, and especially on promoting reproductive health services across Eritrea.
The Health Minister, Ms. Amina Nur Hussein, also highlighted the existing good cooperation Eritrea enjoys with the UN in general, and particularly with the UNFPA. She further pointed out that Eritrea was one of the few countries who achieved the health-related Millennium Development Goals, MDGs, and is working towards the pre-elimination of malaria, eradication of trachoma and soil-borne diseases, and the remarkable reduction in HIV/AIDS. Likewise, she pointed out the reduction of maternal mortality, increase in antenatal coverage and skilled birth attendants, and high coverage in immunization and vaccine. The minister further highlighted that Eritrea's achievements are anchored on community mobilization and the concerted efforts of all stakeholders and partners, and that Eritrea will continue to work with the UNFPA in particular to ensure universal health coverage and achieve the targets of the SDGs. The minister added that the cooperation with partners has made pivotal contributions to the achievements Eritrea has made.
I'm impressed by the leaders in government, like the Honorable Minister of Health, Amina Nur Hussein. She is not only experienced, dedicated, very inspiring, but she is very passionate. She does the job because she believes that it is possible to change the health conditions of many Eritreans who desperately need them. So with her leadership and passion, a lot of things have been taken place.
The high-level UN delegation also met with implementing partners and heads of National Union of Eritrean Women, National Union of Eritrean Youth and Students, and Asmara College of Health Sciences. At the meeting, Mr. Dereje was briefed by the National Union of Eritrean Women on the National Gender Plan and the Sectoral Action Plan in place for gender mainstreaming and the need for the UNFPA's continued support on economic empowerment and social protection of women. Likewise, the National Union of Eritrean Youth and Students also expressed gratitude for the existing support to the empowerment of girls, youth and adolescents through education. The representatives from the Asmara College of Health Sciences on their part said that continued support is essential in human resource capacity building in order to properly address the health of women as well as in strengthening laboratory and research.
I think Eritrea, for me, I was here 5 years ago, and it remains very strong in its commitment to ensure the well-being of its people, including its women and its young people. And even then, when I came, we saw progress in terms of maternal health. For us in Eastern Southern Africa, Eritrea was one of those countries that actually was able to achieve a reduction in maternal deaths. And as coming back and just seeing the information that the health facilities have captured, the quality of life of women, I can see progress. And indeed, I think when we listen to the leadership here and their interest to even move faster on their development trajectory, move faster ensuring that the health and well-being of their people improves, move faster to ensure that youth really develop and take on this country and move it forward in terms of their leadership and their engagement. I think that's very positive and very optimistic for me.
In the evening hours of the same day, the UN Assistant Secretary General and UNFPA Deputy Executive Director also met and held talks with development partners based in Eritrea. He called on them to channel resources to support the development work in Eritrea.
I had the opportunity to meet a number of government officials, senior diplomatic representatives based in Asmara. I was impressed the keenness of the international community to cooperate and support Eritrea at this point in time, where the hopes and the aspirations are, increasing.
A dinner reception was hosted at the Asmara Palace Hotel in honor of the high-level UN delegation by the UNFPA, government officials, UN country team, development partners and staff.
For me, I really would like to thank you on behalf of United Nations and UNFPA.
In a speech delivered at the dinner reception, Mr. Dereje said that the current peace agreement between Eritrea and Ethiopia bodes well for the two countries and the sub-region as a whole in channeling resources to development for the betterment of the lives of the people, adding that the UN is committed to supporting Eritrea to sustain its impressive development gains in recent decades.
We'll see a lot of progress as well. So once again, thank you so much. My first impression is I've seen the impact of the new change, especially the impasse that has been there in terms of peace and security between Ethiopia and Eritrea is now broken, thanks to the leadership of the two countries, especially His Excellency, the President of Eritrea, Ato Isaias Afwerki, and our own Prime Minister, Dr. Abiy Ahmed. They made major change, courageous change. This has impact inside Eritrea and also impact in Ethiopia and in the Horn of Africa. When I came in here, I have seen the impact of the stagnation for a long time in terms of social and economic activities.
The next day, 19th October, the high-level UN delegation headed by Mr. Dereje and accompanied by the Minister of Health, Ms. Amina Nur Hussein, and a UNFPA leadership team visited health facilities in Mandafara to see the impressive gains made by the country in improving maternal and neonatal health in the Zoba. During the course of the tour, they also met the governor of the southern region, Mr. Ephraim Ghebrekhustos, who commended the cooperation UNFPA continues to extend in supporting mothers suffering from obstetric fistula at the Mandafara Referral Hospital and the maternity waiting home at the Atwala Community Hospital. The maternal and neonatal health interventions supported by UNFPA at the Mandafara Referral Hospital, including the medical treatment and rehabilitation of fistula survivors, were a highlight. The hospital is the national referral hospital for fistula in Eritrea, and the rate of the incidence of obstetric fistula has declined remarkably. As part of the rehabilitation work, fistula survivors receive psychosocial counseling, vocational training and literacy classes at the hospital, which Mr. Dereje was pleased to witness these achievements firsthand.
I was impressed by my visits. I met so many government officials, went out to see some of the projects. I looked into the data of performances, especially in the education and health sectors. All are showing major progresses, decline in maternal mortality, child mortality. This would not have been achieved without hard work and commitment of the ordinary people, the experts, and the leadership of the government.
UNFPA Eritrea has been accompanying the government in a few sectors, and particularly in the health sector, to ensure that no woman should die while she gives birth, to repair a number of fistula cases that have happened, and so the fistula program continues to get richer, to ensure that young girls, and particularly women, feel equally and empowered to really do what they need to do. So it's good to see that UNFPA is really perceived and is delivering in support and in accompanying the government in its priorities.
The group also toured the maternity waiting home at the Atawala Community Hospital, which is supported by UNFPA.
I went also to the Atawala Community Hospital, where they give services to mothers before they give birth, helps them to give safe birth, and also looking after them and treating fistula when they happen once or twice, so that the total fistula cases are reduced.
To see a country which is really developing, I could see a considerable effort which has been made by the government here to first of all develop the infrastructure, provide social services. I was very impressed to meet with the Ministry of Health officials and get a briefing to learn about the amazing progress which has been done in reduction of maternal mortality, then in reduction of infant mortality. Today I have visited hospitals in the provinces, and I could clearly see that the quality of services which is made available in the clinics is high, that we have a considerable amount of progress which has been made, both in access to family planning services, in access to neonatal care, and in access to the essential reproductive health services for women.
Mr. Dereje acknowledged the tremendous achievements made in maternal and neonatal health and said that Eritrea has a lot to tell the rest of the world on achieving the transformative results UNFPA is pursuing, ending preventable maternal death, ending unmet need for family planning, and ending gender-based violence and harmful traditional practices against women and girls, and that UNFPA is to step up its cooperation to help the country achieve its development targets.
UNFPA is mandated to work around the reduction of maternal mortality, working to improve family planning through information and services, working to reduce harmful practices, especially ending female genital mutilation, ending child marriages. The work around maternal care, I was able to visit the Mendefera Referral Hospital where the Fistula Center is placed.
I think coming here as a regional director, looking at the region of Horn of Africa and seeing the challenges, but also seeing what Eritrea has been able to do, I go away with a rich experience of what can be done, and with a real sense of humility and really a sense of drive that in fact UNFPA can even do more.
Almost there are referral hospitals in every province, and there is a lot of training of frontline health workers, especially midwifery and nurses. In every referral hospital or community hospitals, there are doctors who are not actually paid that much money in terms of salary and rewards, but who are very dedicated, believe in what they are doing, and they go to work every single morning to add value to the people they are serving. So this country is showing that possibility. We have a lot to learn from Eritrea. Eritrea has a lot of stories to tell to the rest of the world. So as much as we show the example Eritrea has demonstrated over the last several years, we need to also bring in experience, knowledge, resources to accelerate the progress that have been registered already. I am very much inspired, very energized when I go back to New York. I will be sharing the stories I've heard, the pictures I have taken to show that Eritrea is in the right track. Eritrea is making progress.
Following its return from the field trip to the southern region, the high-level UN delegation met and held talks with the Minister of Foreign Affairs, Mr. Osman Saleh. At the meeting, the minister stated that this is the time where Eritrea is receiving international visitors who are eager to come and observe the work so far achieved and the new relationship established with neighboring Ethiopia. He further underlined that the government of Eritrea has been tirelessly working towards the achievement of peace for so many years, and despite those difficult circumstances and with meager domestic resources, the government was able to achieve significant strides in meeting social justice, especially in areas of health, education, soil and water conservation, and agriculture, with the ultimate goal of achieving food security and equity at all levels. The minister further expressed that more needs to be done, especially in human resource development, and that moral boost and support is required. Expressing congratulations on behalf of the whole UN country team for the current developments of peace within the Horn of Africa region in general and between Eritrea and Ethiopia in particular, under the leadership of His Excellency President Isaias Afwerki, Mr. Dereje said that he had fruitful discussions with different ministries, partners, and had the opportunity to meet with the communities at the field level and appreciated the warm welcome he received. Mr. Dereje said to the minister that the development gains Eritrea has made on many social indicators in recent decades was impressive and a good example to the rest of the world. He further reaffirmed the commitment of the UN in general and that of the UNFPA in particular to support the government in addressing the priorities and pushing further the achievements so far attained in all spheres of the economy.
I have very useful conversation with a number of government ministers. We discussed overall the socio-political changes in the Horn of Africa and how that is bringing positive impact here in Eritrea. We should expect the acceleration of economic activities, social activities, because of the new ports in Eritrea like Asab and Sowa will be open. More commercial activities happening between Ethiopia and Eritrea. This is already ongoing. I've seen a lot of trucks coming this way. People also taking their goods to Ethiopia and having trade happening. So this eventually would require leadership and regulation, how the businesses that are ongoing, the social interrelations are ongoing, benefit both countries.
The high-level UN delegation completed its 2 days working visit to Eritrea and left the country in the evening hours on the 19th October 2018.